Hello, my name is Snita Vark, and I am a nursing student at BCIT. I will be discussing the breastfeeding challenge of jaundice and flat nipples today. By applying the situated decision-making framework, we will develop a care plan for the breastfeeding challenge of an infant with jaundice and a mother with flat nipples. The situated decision-making framework consists of knowledge, cues, judgment, decisions, and evaluation. Jaundice is a medical condition where there is excessive circulating bilirubin, which causes the yellowing of the skin and sclera. Bilirubin is formed from the breakdown of hemoglobin. Hemoglobin breaks down into unconjugated bilirubin, which is to be broken down by the liver into conjugated bilirubin, so it can be immediately eliminated. But since an infant's liver is immature, it takes a long time for the liver to break down the bilirubin into conjugated bilirubin. Therefore, the unconjugated bilirubin builds up in the infant's bloodstream and can only be eliminated through stool. High circulating unconjugated bilirubin can cause kernicterus, which is a medical condition where a high level of bilirubin can cause irreversible neurological damage. This is because conjugated bilirubin is water soluble, therefore it does not damage the brain tissue. However, unconjugated bilirubin is fat soluble, which can enter the brain tissue causing damage. The infant needs to be exclusively breastfed in order to eliminate the bilirubin through bowel movements. There are many causes of jaundice, but there are three types of jaundice. The first one is physiological jaundice, which occurs from approximately day 3 to day 7. This type of jaundice occurs when normal hemolysis of fetal red blood cells and liver immaturity lead to a buildup of unconjugated bilirubin. Pathological jaundice occurs within the first 24 hours, and it is from antibody reaction where the infant receives antibodies from the mother's blood through the placenta due to blood incompatibility. The antibodies attach to the infant's red blood cells, resulting in hemolysis and risk for jaundice. The third type of jaundice is prolonged jaundice, which persists past 7 to 10 days. This occurs from exclusive breastfeeding, infection, hepatic disease, biliary condition, and total parental nutrition. Another cause of jaundice can be the infant's not getting enough breast milk due to improper latch or no active sucking. A mother with fat nipples may have difficulty latching the infant onto the breast. Here is a picture of an inverted and flat nipple compared to a normal nipple. As you can see in this picture, a flat nipple does not look as pointy and erected as a normal nipple. Flat nipples can cause feeding difficulties due to incorrect latch, decreased suck reflex, and sore nipples. Infants do not require nipples that appear like an artificial nipple to breastfeed, because an infant has to have a majority of the areola in their mouth in order to breastfeed. Therefore, having a flat nipple should not make it impossible to breastfeed. Signs and symptoms of flat nipples are poor latch because the infant's having difficulty latching on to a flatter nipple, which can also lead to sore nipples if the infant has an incorrect latch onto the nipple. And this also leads to difficulty with breastfeeding, which is also another indicator of flat nipples. And lastly, upon cold stimulation, the nipple does not erect. Signs and symptoms of jaundice are yellowing of the skin and sclera, which also includes yellowing on the face, chest, abdomen, and soles of the feet. Another indicator is infant is very sleepy and may have feeding difficulties, decreased infant output and weight, a high-pitched cry, and also high serum bilirubin levels. So the therapeutic range for bilirubin levels in an infant depends on how old the infant is. If the infant is from 0 to 24 hours, bilirubin below 120 is therapeutic. If the infant is 24 to 48 hours, bilirubin of 180 and below is therapeutic. An infant from 48 to 72 hours, a bilirubin of 210 and below is therapeutic. Judgment related to jaundice can be that the infant is sleepy and not feeding well. This can discourage the mother to breastfeed and less bonding between the infant and mother, and this may also lead to decreased milk supply. Another one can be difficulty breastfeeding due to poor latch and suck, incorrect position, maybe the mother has mastitis, sore or flat or inverted nipples. So at this point, you should involve or consult with the lactation consultant, the physician. If the patient is being followed by a midwife, consult with the midwife, and also consult with the pediatrician. And if the mother is at home, she should definitely consult with the public health nurse, and if she has a midwife, consult with the midwife. Judgment related to flat nipples can be poor feeding relationship between the infant and mother. This can discourage the mother from breastfeeding and cause decreased motivation to breastfeed, as the mother may feel her nipples are not suitable for breastfeeding. You can involve or consult with a lactation consultant and the midwife. If the mother is at home and is having difficulty, She should consult with a public health nurse, and if she has a midwife, she should consult with a midwife. The 3 priorities for jaundice and flat nipples are exclusive breastfeeding. Encourage the mother to rotate between the breasts to ensure milk supply in both of the breasts. Educate the parents to avoid specifiers, bottle feeding, and replacement of breast milk such as formula. Secondly, effective latch and suck. Ensure the infant is placed correctly for breastfeeding. If the infant is not sucking at the breast, encourage the mother to hand express breast milk into the infant's mouth, as a taste of the milk can stimulate the infant to suck. Pumping the breast with an electric pump can help to maintain a milk supply and can be used to supplement the infant after each feed. Thirdly, early and often. Encourage the mother to frequently feed the infant and increase the duration of feed. For the management of jaundice, mothers should exclusively breastfeed, approximately more than 8 feeds per day. They should increase the duration of breastfeeding and make sure there is an effective latch and the infant is actively sucking. You should encourage the mother to do lots of skin-to-skin and or kangaroo mother care. Kangaroo mother care improves thermal regulation, support for exclusive breastfeeding, and early recognition or response to illness. For treatment and nursing interventions, assess the infant's skin and motor strength. Assess the baby in natural light as yellowing is more noticeable. Observe the sclera, oral mucosa, and skin. As a nurse, you can check the bilirubin level by using a bilirubinometer after 24 hours of life. A serum bilirubin test can be done if there is yellowing of the skin present, or the baby is sleepy and not feeding well. Assess the infant's latch and suck and how often the mother is breastfeeding. You also want to identify the cause of jaundice, and if needed, supplement the infant with expressed breast milk. Lastly, phototherapy may also be done if all other interventions are not effective. Mild jaundice does not require phototherapy. Decisions related to flat nipples are: ensure the infant has a proper latch and suck. Ensure the infant is in correct position for feed. Breast pump can also help to ensure ongoing milk supply after attempting to latch the infant on the breast and may also help to erect the nipple. Involve the lactation consultant and try not to interrupt feeds with unnecessary procedures or assessments. And a nipple shield should be your last choice. Another technique you can do is pull back on the urola before you latch the baby on. Place your thumb on top of the breast with the fingers underneath and pull back on the breast toward the chest wall, as you can see in this picture. Evaluation for jaundice and flat nipples is: you want to see a decreased bilirubin level, the infant is alert and not sleepy, there is exclusive breastfeeding with no feeding difficulties, the mother feels supportive, and the mother is knowledgeable of jaundice, how to manage jaundice and flat nipples. She is aware of the resources available such as a public health nurse, and also if the condition worsens, to seek medical help immediately. To summarize my presentation, jaundice is excessive bilirubin in the infant's blood. The infant may have yellowing of the skin, be sleepy resulting in poor feeds. This may make the mother feel discouraged to breastfeed, but bilirubin can only be eliminated by stools. Flat nipples tend to be flatter in appearance than normal nipples, which can cause feeding difficulties due to poor latch and suck. This may make the mother feel upset as her nipples are not helping her feed her baby. But the shape of the nipples does not make it impossible to breastfeed. Therefore, mothers with flat nipples can still breastfeed. Therefore, remember the 3 priorities. Firstly, exclusive breastfeeding. Secondly, effective latch and suck. And thirdly, early and often. Thank you for listening to my presentation.